Now, we're going to be having Dr. Emily Brigham to come up. Emily is the assistant professor of respiratory medicine at UBC. She cares for patients with respiratory disease at VGH and in outpatient practice at the Lung Center. Dr. Brigham has an additional appointment as research scientist within the Vancouver Coastal Health Research Institute and affiliated with the Legacy for Airways Health, investigating diet and nutrition as potential tools to reduce the respiratory response to air pollution. Please welcome.
Thank you. Okay. So I'm really pleased to be here today. Thank you to BC Lung Association for having me, and also to all the patients who've come today, patients and family members and so forth. So my very first disclaimer with this is that I'm a respirologist. I'm not a nutritionist, and so I'm very interested in diet, but I am not a nutritionist. So this is the information that I have from my side. I'm interested in looking more closely at the impact of diet and nutrition on COPD, and I'll share with you some of the knowledge that I have. And today we'll talk a little bit about diet and health in general, which I think is a topic that's important for all of us, regardless of COPD or not, and then get down to the specifics of diet and chronic COPD, as well as guideline recommendations and what's out there. We'll talk a little bit about some emerging research that may not be proven yet, but I think is in the pipeline for trying to figure out the impact of diet in folks living with COPD. And then talk about some practical considerations, breathing and eating with COPD, how we move air, moving air with COPD, and then some tips and tricks surrounding eating and nutrition. So we know that over time our diet patterns and what we've eaten as a society has shifted. And as time has gone by, more developed nations have really started to take in more of what we call a Western-style diet. And this is shown in red here with my scales tipping up above that. But that's been an increased intake of things like processed foods, refined grains, meats, and fast foods. We think about more high-fat foods, sugar-enriched desserts and drinks. And all that has really taken the place of some of the things that we know are helpful in our lives, including fruits, vegetables, think about whole grains, poultry, low-fat foods, and things that contain antioxidants and anti-inflammatory properties. And indeed, this is a slide from the World Health Organization where they're looking at causal pathways for the development of many different chronic diseases. And here it's very well recognized that an unhealthy diet is along the causal pathway to many different types of chronic diseases. And not only that, but it's a modifiable factor, right? We can all, to some degree, change our diet, some with more access than others, and something that I think we're working on, but it's something that can be changed. And if you look all the way to the right-hand side, you can see chronic respiratory diseases inclusive of COPD. But I think some of the evidence supporting a direct role of diet and the development of chronic respiratory disease is still developing and something that researchers are looking into. We know that the lungs see everything, right? Our lungs have their own immune system. Our lungs are the barrier from the outside world to our inside world. We have a tremendous amount of air that moves in and out of our body over the course of a day. And with that air, there are a number of substances in the air, including pollutants, allergens, viruses, bacteria, and so forth. So our lungs are processing all of those things. The exposures may differ by where you live and differ based on indoor and outdoor environments. And I've posted here some differences that you may see between more rural and more urban environments, but there are commonalities there as well. On the top, it's kind of hard to tell what those things are, but that's bacteria, viruses, fungi, allergens, and so forth that our lungs are processing. And all this is occurring in the state of changes of weather, right? Extremes of heat and temperature, which I'll be talking about next actually, but storms and so forth. And then surrounding all of this is the context of ourselves, our genetics, so that's DNA on the top, and how our body processes these exposures. And then the context in which we process these exposures. So our social networks, our community, our families, our infrastructure, our housing, the buildings that we spend our time in, and then our economic resources and access to care to help to change these processes. And all of this together comprehensively impacts on the incidence or the development and the degree of disease that any one of us has in response to that. One of the factors that we think is on this pathway, getting from all those exposures over to the development and worsening of disease, is inflammation and oxidative stress. So in science, we are measuring a lot of factors that are markers of inflammation, markers of oxidative stress, and this is really a result of activation of the immune system and irritation of the cells of our body, and this is the response that our body makes. And we think that the response to some of that irritation, some of that immune activation in individuals becomes disease. And then those individuals continue this cycle of inflammation and oxidative stress, and this is true in COPD. And one of the questions we have is whether or not diet may play a role in either mitigating or reducing this inflammation and this oxidative stress, or in actually promoting it. So is it possible that diet is important at this really critical step? And that's what we're researching. So again, back to diet, it's something that's modifiable, it's something that we're all exposed to. We have to eat, we have to drink, and is there a way that we can make it work for us to really optimize our health? So I'm going to go first to what's known. And I will say that a lot of other disease states have much more research and background in what is important in specific components in diet. And I think that this research is developing in COPD, but it really is truly farther along than many other lung diseases that we have. There are a lot of guidelines for care in COPD. A lot of people are thinking about this, thankfully, and I've gone through all of these different guidelines, including BC, Global Initiative for Lung Disease, which is global, of course, Canadian Thoracic Society, and pulled out some of the references to nutrition. And what's stated is that really nutritional efforts should be coupled with other standard practices. So think about nutrition, right? It makes sense. That should be important. That nutritional supplementation should be provided in individuals who are malnourished. We know that folks who have poor nutrition may be more susceptible to infections and less likely to heal. And that malnourished, hospitalized patients should be considered for protein-enriched supplementation to keep up muscle building and so forth. We also know, and I'll show some of the studies that have demonstrated this, that diet to maintain a body mass index somewhat in the normal range may be important, and that there's harm that is associated with a lower BMI. So being underweight correlates with poor outcomes in COPD, and that nutrition should be considered among other lifestyle factors. In parallel to this, there are actual nutritional guidelines available for COPD. And again, this is one of the only lung diseases that has this available. This came out in 2019 and was based on a systematic review of the evidence that's available. And it's still, I think we still have a ways to go. There were a lot of recommendations that couldn't be made due to a lack of evidence. But it was found that medical nutrition therapy improved outcomes as part of a multidisciplinary program, so it was an important component. That it's important on an individual basis to meet adequate intake of energy and nutrients. And again, individualized assessment. Everybody's dietary needs are a little bit different. But also what's interesting is that these folks recommended to assess and consider repletion of vitamin D under specific circumstances. So we all know that vitamin D is important for bone health, but it turns out vitamin D has a number of immune regulating properties. And in individuals who have 2 or more exacerbations per year and are deficient in vitamin D, there's some evidence demonstrating that repletion of vitamin D levels may actually help to reduce exacerbations. So an important consideration. This has not made it into many of the clinical lung guidelines thus far, but this is in the nutritional guidelines. So what is out there? Well, this is where this evidence came from. So this was a systematic review and meta-analysis, and what that means is that these authors took a look at multiple studies that were out there. They took all the individual pieces of evidence and they put it together, and they looked at everything in total. They combined about 4 trials of vitamin D repletion, so totaling about 560 people with COPD. And as I said, they found that vitamin D supplementation was associated with lower rates of COPD exacerbations, but only in individuals who had below a certain threshold, individuals who were insufficient. And so this may be something that can help patients who have frequent exacerbations and are deficient in vitamin D. Some other studies are out there. This is one actually from quite a while ago. This is from 2010 in the European Respiratory Journal. What was done among 120 participants with COPD. It's a really interesting study. It was 3 years long, and they took half of the participants and put them on regular sort of counseling surrounding COPD, therapy, maintenance, and so forth. And then the other half of the group, they advised them to increase fruit and vegetable consumption by over one serving, at least a serving per day. And at the end of this 3-year study, those who had more fruits and vegetable consumption actually had better lung function in the intervention group. So an interesting study. I think it's important to repeat this. We know fruits and vegetables are helpful in so many ways, so I see little harm in adopting this strategy. But this study has yet to be repeated. But interesting to see that this may be impactful in terms of lung function. And this is a study that came out, which I participated in writing and investigating. This is looking at about 112 individuals with COPD. These folks completed a food frequency questionnaire, which means they gave us they told us about what they ate, right? They recorded that. And what we found in this group is when they reported all that, those who reported higher omega-3 levels seemed to associate with fewer symptoms, as well as higher quality of life and fewer severe exacerbations. Now, this is not a trial, okay? And the difference between a trial and a study looking at associations is that we don't know if there's other things that go along and predict a higher intake of omega-3. It may be that these folks are eating more fruits and vegetables, and that's why we're seeing this effect. So we are not at the point where we can recommend higher levels of omega-3 or omega-3 supplementation for individuals with COPD, but this is a line of investigation that we think needs to continue to understand if that could be beneficial. So on the bottom, does not prove cause and effect, more studies are needed, but this is some of the research that's ongoing presently to understand. Now, I mentioned body mass index as well. So body mass index being a correlation between weight and height, and body mass, and there are certain categorizations that put you in an underweight category, what we consider a normal weight category, and then we can consider overweight and obese. And this is tricky in COPD because when we look at a lot of the data, we look at large population studies, we see something come out called the obesity paradox. And we've seen this in other states as well outside of COPD. And what we find in these correlation studies, so again, these are not trials where we're changing people's weights. This is just looking at the association of being a certain weight and what the outcome is. We find in some studies a protective impact of being overweight or obese on mortality. So sometimes those individuals look like they're living longer than normal weight individuals. That does not mean you should go out and try to gain weight because we also know that that can contribute to symptoms. But it is something that arrives in the literature, and that is out there that epidemiologists are looking at. There's still a question as to whether it's causal or whether it is a anomaly of statistics. You can have some weird things that happen when you're trying to go through data. But this is a study looking at about 16,000 patients who had moderate to severe COPD. These individuals also had cardiac risk. The highest mortality consistently in studies is in those who are underweight with a BMI of less than 18.5. And the question is whether that's a marker of more severe disease, folks losing weight because their metabolism is running higher, they're working harder to breathe and so forth. But we found that when you get to the extremes of obesity, so much higher BMI greater than 40, there's actually an increase in risk again. And there's also the highest pneumonia risk in underweight. So what I'm saying about lower mortality being associated with being overweight or obese, again, these are not causal studies. These are not trials. This is things that we're seeing in the data that we have not yet explained, but interesting, and I think some research you can be aware of. The guideline recommendations I refer back to, again, recommend being in a healthy weight range, BMI of 20 to 25. We also know that there's other impacts of obesity. So obesity, when we look in similar studies and associate that with increased morbidity being more symptoms, exacerbations, lower quality of life, we know that obesity is associated with some of these things. And this is a study demonstrating that in about 3,500 patients with moderate to severe COPD. So we have a lot of questions remaining. So things that we want to know is, are there any foods, nutrients, or dietary patterns are of particular unique benefit or harm in patients with COPD? Right, I've showed some early studies looking into some different nutrients. Should recommended macronutrient content, when I'm talking about that, carbohydrates, protein, and fat, be the same or different for people with COPD? And we've seen some benefit of protein in those who may be in the hospital. And if yes to either, does it vary by cause, severity, or type of COPD? Are there particular groups who benefit more than others? And that sort of goes back to some of the things that Dr. Leung was talking about, where we've seen differential impact of medications in those who have high eosinophils. And here we're seeing a differential impact of supplementing vitamin D in those who have low vitamin D levels. So understanding sort of unique characteristics is really important to determining effect. And lots more. There's always more we're trying to learn. But I also want to talk about some practical considerations. So that's some of the evidence that we're working on. But let's talk about moving air in COPD. And I think this is something that I talk about with a lot of my patients, is the mechanics of breathing. And this becomes important when we're thinking about eating and strategies for eating and getting the nutrition that we need. So when I describe lungs and the way that we pull air into our lungs, I think about a few structures. So there's our chest wall on the outside here shown in gray, and then the diaphragm, which is the muscle, major muscle of respiration in pink here. And at a completely relaxed state, the diaphragm is actually curved up like this, just like that shown. When we take a deep breath in, and when we are in a relaxed state, what happens is that the diaphragm contracts and pulls down. The chest wall remains relaxed, or remains where it is, and we essentially pull air into the lungs through that motion. When you exhale, everything relaxes and everything comes back up. The diaphragm goes back to its curved state, and the air goes back out. And that's a normal, relaxed breath. In patients who have COPD, one of the things that can happen is that the lungs may never go back to that original volume. Sometimes what can happen, because the airways are a little bit smaller, the airways close prematurely as air is coming out, and some of that air gets stuck in the lungs. And when that happens, when the lungs have emptied all the air that they can, they're larger than lungs that have been able to empty all the air that there is. Because of that, the diaphragm starts a little bit flatter, right? Remember, when you take a breath, you want to flatten the diaphragm. So if you're starting at a little bit flatter, it's going to be harder to bring in the same amount of air. You have to work harder to pull the diaphragm down, to pull that extra amount of air in. And sometimes that means using some of the muscles outside of the chest wall as well. And then exhaling, you breathe out. So let's think about what happens with an overfull stomach. So we have a diaphragm that's already having to work a little bit harder because it's having to pull down from a less of a relaxed state. You're also using these extra muscles out here. And now you're putting something below the diaphragm for the diaphragm to have to work against. And so the amount of force that's needed to get that diaphragm down to a spot where it's pulling in air and to get the lungs to open up is much, much larger with an overfull stomach. Now, if you're not feeling shortness of breath with eating, this isn't necessarily something you have to worry about or prevent. But if you're finding that you're getting to the middle of a big meal and you're having a lot more trouble breathing, this may be one of the reasons why. So there are a number of tips out there for eating with chronic lung disease and eating with COPD, and things to think about if you are getting short of breath during meals, knowing that nutrition is so important. So if you are experiencing shortness of breath with meals, things you can think about are smaller, more frequent meals to get in the calories that you need. Foods that are easy to chew, you're not working as hard while you're eating. Eat very slowly, chew well, small bites. We don't want anybody choking if they're working harder. You can rest and use bronchodilators before meals to open up the lungs a little bit more and allow the diaphragm to relax more while you're eating. And avoid foods that cause bloating or gas, give that overfilled stomach early. And these are different for everybody, but certainly things like soda and gas-forming sulfur-based foods can contribute to this more commonly among individuals. If you're feeling full quickly or early in the meal, think about limiting liquid intake during meals. That doesn't mean necessarily limiting your liquid intake, but trying to get the calories in while you can. Smaller, more frequent meals we talked about, and avoiding constipation as much as you can, which again can put that pressure on the diaphragm. With fatigue, setting a timer to remind you to eat. Think about food as medicine. Eat your largest meal when you have the most energy. And then if you know that there are times when you like to cook, think about cooking extra and putting it away in the freezer so you have these nutritious meals available. And consider meal delivery services, which nutritionists can connect you with. And then for those that are experiencing issues with a lot of mucus, sometimes that can change your taste. Sometimes that can just make it harder to sort of breathe through your nose in other areas while you're eating. Think about doing your airway clearance before you eat and make sure you have appropriate hydration throughout the day in consultation with your doctor. regardless of all the research that we're doing and the evidence we're trying to generate to understand if there's anything unique in patients with COPD, I think the most important thing is to make sure that you are eating as best as you can and as healthy as you can in line with Canadian guidelines. So thinking about high fruit and vegetable intake, thinking about protein, fiber, and making sure you're following general nutritional guidelines, and to the degree that you can, think about meeting with a nutritionist. In addition, BC Lung, so I've put this up here, has a number of, actually has a really great video on there giving some tips and tricks for nutrition in patients with COPD. And then the COPD Foundation also has some more. But of course, these resources do not replace individualized nutritional advice. Referral to a nutritionist is recommended in the case of nutritional questions that can't be answered by your GP or your respirologist. But these are some great resources to really look through. And with that, I'm happy to take any questions.